virus response. My name is Brian Beam. I'm Parish Administrator for Calcasieu Parish. It feels a little funny today. We haven't had a public briefing on this in a while, and when we did last time, it was interspersed with the hurricane recovery. But this today is strictly for COVID-19, and it is very important, as we all know. Last time we talked about this, and we need to continue to, it's about the measures that people need to take to prevent the spread of the virus. But we have a lot of new information as well today on the status of the vaccine, but we're going to talk about all of that. And we have a few speakers today. We're going to lead off with our Emergency Preparedness Director, Dick Grimion.
Like Brian, last time we were at this podium, we were talking about, like Brian said, we were talking about hurricane stuff. We didn't imagine we'd be back here this soon. I just want to cover a couple of things. We'll get right to the medical part. This week on Tuesday, the governor announced that we were going to stay in the phase 2 of the recovery from COVID through February 10th. And all of the, if you need the particulars on it, the governor's website has either the proclamation or a list of those items. The other thing I want to do real quickly is go over the current CDC advice for hygiene. A couple of these are common sense, and you know most of them. Wear a mask over your nose and mouth. We get a lot of calls from people saying, hey, we see people wearing their masks, but they're not covering their nose, and that's at least half of the problem. So make sure that you cover your nose. Social distancing, stay 6 feet apart from each other when possible. If not possible, then wear a mask. Avoid crowds. I think that's a common sense type of advice. Avoid poorly ventilated spaces or small spaces when you're confined with other people. Wash your hands often. We've gone over that several times. Very important for you to wash your hands, particularly if you need to touch your face or your eyes or something like that. Make sure you wash your hands beforehand. Cover coughs and sneezes with your elbow. Clean and disinfect your area. And something that we, the medical community will talk about is monitor your health daily. It's very important that you stay conscious of any changes that you have in your health, particularly temperatures and things like that. So with that, we'll turn this over to Dr. Lacey Cavanaugh, Region 5 Medical Director for Louisiana Department of Hospitals.
Hi, good morning, everyone. I know most of the questions today are probably going to center around vaccines and administration, so we'll save that sort of for the end. I want to spend a few minutes at the beginning just talking about where we are in terms of COVID-19 in Southwest Louisiana right now. Right now, our cases, our daily case count per day is actually at the highest that it's ever really been throughout this entire pandemic. We are seeing the greatest number, of course, in young folks, so that 18 to 29-year-old age group that we've seen a lot of cases in before still leads the pack. But we are seeing it, of course, across all age groups. But the majority of the deaths that we are seeing are in people who are over the age of 70. And I really want to point that out today because as we talk about vaccines and who qualifies to get a vaccine now, really the goal of this vaccine is to save lives at the end of the day. And so we have to focus on the people who are dying. So even though the 70-plus-year-old age group doesn't have the most cases, they have the most deaths by far. So I wanted to mention that. In terms of our COVID-like illness rates, they seem to be pretty stable, and we're watching those. Our percent positivity, the most recent week's average for the 5-parish region was about 13.9%, which, as a reminder, is still pretty high, although we have had times that it has been higher. It's still above that 10% threshold that we consider from the CDC as widespread community transmission. Our hospitalizations, though, in some good news, and we'll hear from some of the medical professionals in our community later in this segment, but Our hospitalization data actually looks okay. I mean, hospitals are extremely busy, but we've been hovering between 90 and 100 hospitalizations across the region on any given day. And that's been pretty steady, kind of on a plateau for a while, really since around Thanksgiving. So that's good news, and I think that has to do with a lot of factors. One being that we're now starting to have some effective treatments for COVID-19, which is wonderful news. Also, we have to remember that a lot of our nursing homes in this region are still evacuated from the hurricanes, and those are folks who have a high chance of ending up hospitalized should they get COVID-19. So it is good to see that our hospitalizations are not on a trajectory that is rapidly increasing like we've been at some other points. I know there's a lot of demand for data in regards to the vaccine, and I just want to say that I think a lot of it is going to become available. I know we're working on some new tools to map out vaccination rates, especially as this goes forward. We're not at a place yet that we have a lot of that data available, but I do want folks to know that there will be a point in time that we will be able to go to the LDH dashboard and really sort of track how our communities are doing in terms of vaccination going forward. So that is to come. I'd also like to talk briefly about testing. So we are still doing testing across the community. There are lots of urgent cares, primary care clinics, of course our hospitals, even our public health units that are able to do testing. We also still have the big site, the high volume drive-through site that the National Guard is helping us with at the Civic Center. And that site is testing still anywhere from 75 to 100 people a day in this community. So testing is widely available. That site is open from 8 a.m. to 3 p.m. Monday through Friday. Although testing is widely available, our testing per capita still remains very low in comparison to the rest of the state. We are not testing as many people as our counterparts in other regions. So I just want to remind folks that should testing be needed, it is really truly widely available in this community from a variety of sources now. Also wanted to mention the new strains that folks may be hearing about in the news, from the South African strain to the UK strain of the virus. Preliminary reports say that this strain could be more easily transmissible from person to person. We don't think at this point in time that it's more serious or more deadly or that it causes more hospitalizations, but of course this is new. So sort of like the beginning, I think there's still a lot of data that will come as we learn more about this strain. Several places across the United States have already reported cases, and here in Louisiana we have no reported cases of these strains yet, but it's very possible that these strains could already be in our community. We don't do a huge amount of surveillance in this state in terms of sequencing these viruses. So we do send some samples off to the CDC, and I know that those numbers have been increased in response to knowing this new strain is out there, so that hopefully as it enters, if it enters our community, we will know about it. But once again, I think there's still a lot that we have to learn. We do, at this point in time, we have no reason to believe that our tests or our vaccines wouldn't work against this new strain, but once again, it is new, so we do have to test these things, and I think more information will come out about that over time. So I'll move into the vaccine now, because I know this is going to sort of be the big topic. And I just want to start with saying that the intention of these vaccination efforts really is, at the end of the day, to save lives. And the intention is also to make sure that everybody in our community who wants to receive a COVID-19 vaccine is going to have that opportunity at some point. We know that there are a lot of frustrations out there in the community because we're hearing, vaccine is starting to become available to those priority groups, and yet it feels so difficult to obtain a dose of one of those vaccines. And that's really because the supply of the vaccine at this point in time is still very limited. Although we are starting to receive vaccine, it's in such small quantities that those quantities don't even come close to meeting the demands that there is for a vaccine. So I'm just encouraging people to really have a lot of patience with this process. It is going to be a process. And it is going to take us some time to ramp up the supply chain of these vaccines so that they become more available. I really think that every week going forward, there will be more available and it'll be more widely spread out. And so it's coming. We just need to be patient and flexible as we wait for this process to sort of play out. I want to talk about the two vaccine products that are out there on the market. There are actually two vaccines that are out there. There's a Pfizer and a Moderna product, and both of them are two-dose series. So either 21 or 28 days after the first dose, a second dose is required. Both of these are mRNA vaccines. mRNA is not, it is a new technology to be used in vaccines, but it's not a new concept. We've been knowing about mRNA for many years. And so I do just want to reassure folks that even though these products came out quickly, they are very well tested. I was very pleased when I first saw the clinical trials come out in December on the mRNA vaccines, and I was really pleased with the safety data and how big those were. There were 30,000 to 50,000 people in those trials as part of studying the vaccine. So I do feel that they were thorough, and I feel very confident that the vaccine is safe. That mRNA codes for a spike protein, which is what allows COVID to get inside your cells and wreak havoc on your body. So just like other vaccines work, this mRNA codes for the spike protein that's produced, and then your body's immune system reacts to that and learns how to fight COVID-19 to keep you from having COVID-19 enter your own cells if you actually get exposed to the virus. So it works very similar in a lot of ways to other vaccines that are out there for other diseases. In terms of side effects of the vaccine, a lot of the same side effects that you might see with other vaccines. So people report arm soreness, sometimes low-grade fever, body aches, fatigue, and these are all actually part of your immune system learning how to react to that spike protein so that you're protected. And so very common side effects that we see with any other vaccine are applicable here. There have been a couple of cases of what we call anaphylaxis, which is a severe allergic reaction, but those have really remained extremely rare despite pretty widespread distribution across the United States. So in terms of distribution, we are working very hard to try to push vaccine out to places within the community. And once again, the limiting step here is really how much vaccine is actually available. I want to convey that I'm very confident in our medical community here in Southwest Louisiana, as well as our local officials and in my public health team. And I feel extremely confident that as vaccine supply increases, that these teams will do a remarkable job getting it out as fast as possible within our communities. We definitely stand ready to really tackle COVID-19 through vaccination as soon as we get enough supply of doses. So far, most of the doses that have come into the region have come to hospitals who have used those to vaccinate their own staff. They have also gone to long-term care facilities, so our nursing homes that are so vulnerable against COVID-19. It's gone to them, and so they've received a large portion of our allotment as a state to try to protect our most vulnerable. And just recently, some doses have started to go to small community pharmacies and pharmacies around the community. But you have to remember that very small doses, pharmacies may only receive 50 or 100 doses of vaccine, and yet in this current phase, there are over 600,000 people that are eligible for receiving the vaccine based on the current criteria. So there just still is a lot more demand. So please be patient with those pharmacies and other places in the community that are starting to get doses. It will increase over time. So folks kind of want to know what should I do right now if I know that I qualify to get a vaccine, and the qualifications are over the age of 70, so 70 or over, as well as healthcare workers, so people who work in the healthcare fields, and that's a pretty broad definition. It could include outpatient clinics and and dialysis providers and home health providers and all of those folks. So if you qualify for a vaccine, what should you do right now? And the answer to that question is really try to be patient. It's probably reasonable at this point if you have, a clinic or a doctor's office or a pharmacy that you usually use. If they are taking a waiting list, it's reasonable to get on that waiting list because that will help if they receive some doses of vaccine. They may have some availability to call you and schedule. But really, that's what we're telling folks right now is to try to be patient because this will become more available as we get more doses. So. If you are a provider in our community, so a doctor's office or a clinic that has the capacity to receive vaccine and distribute it, if you want to sign up to become a receiving site when we get more vaccine, if you could contact our Office of Public Health, our phone number is 475-3200, and we will be happy to help assist with the enrollment process. Currently, we have about 56 sites enrolled across Southwest Louisiana that stand ready and willing, and we are enrolling more and more and more sites every day. That number has probably increased even since the last report I got. So we are standing ready. So I will pause here, and Teresa, I'll take questions perhaps after we let our medical professionals talk. I'll come back up and take some questions. So our first guest speaker is going to be Dr. Jordan from Lake Charles Memorial Hospital.
Thank you, Dr. Kavanaugh, and good morning, everybody. It has been quite some time since we've been in this room, and I think if we reflect back when we last met and we were be told that we'd have treatment, both outpatient treatment for people with COVID and a vaccine, we would have been joyous. So I think where we are today, we should be very hopeful. That's certainly a message we all should take away from today, that we are certainly closer to the end of this pandemic today than we've ever been. Don't want to go back over the volumes. I think Lacey did a great job reviewing where we are with volumes. For Memorial, after Delta, we kind of settled into a volume of about 15 people in the hospital. And then after Thanksgiving, obviously things ramped up. And we've been in the 30s consistently since the end of November. We got up to 40 for one day, but we've kind of plateaued for far as hospital census, which is a good thing. There are other regions in the state that haven't plateaued. They have continued to escalate, and they are at extreme volumes. Our volumes right now are certainly higher than they were in April, but they're not quite as high as we saw in the summer in July. The demographics really haven't changed outside of the nursing home population. We're still seeing the same patients affected by COVID that require hospitalization. It's the elderly with comorbids. So that really hasn't changed at all. I think one thing that has changed, and it's also a positive, is the acuity is somewhat a little bit less. We see a little bit less demand for intensive care unit admissions and ventilatory support. And that's probably in part due to a better understanding of how to treat this with steroids, remdesivir. So I think we are doing a better job in the acute side of treating COVID. One of the reasons to have hope is the availability of monoclonal antibody. And this is really the only treatment we've got right now in the outpatient setting for people with COVID. And the indication is for patients who have mild to moderate COVID who do not warrant admission to the hospital and who are not on oxygen. But the monoclonal antibody, by all accounts throughout the state, is really changing the curve as far as admissions. We've given out almost 300 doses right as of today, and I'll tell you locally it's made an impact on admissions. So another reason to be very hopeful, and we certainly are appreciative of the supply the state's given us with regards to the antibody. The vaccine, and again, I will tell you, standing here today, if somebody told us in the summer we'd have an effective vaccine, we would have been very, very happy about that, and we should be. This vaccine, by all accounts, is very, very effective. We were hoping when this vaccine was starting to be worked on as early as March of 2020, this was being worked on that early. Because Lacey did say this messenger RNA is not a new technique. It's the first time we've used it for the delivery of a vaccine, but it's not a new science. But it's very effective, more so than we'd hoped for. We were hoping maybe something around 70, 80% efficacy, and it's above 90, if not 95% effective. The other thing, it's very safe. We've given out almost 2,600 vaccines at Memorial, and I'll tell you, we're seeing what we expect. We're seeing the post-vaccination response, which is the sore arm, sometimes joint pain, muscle aches, but these are all expected. We've not seen a single case of anaphylaxis or anaphylactoid reaction that would require emergent care. We have seen some rashes, but these are all expected responses to the vaccine, and actually it's what you hope to see. That means the body is responding in a favorable way to the vaccine. I do think with regards to the distribution, we were told by the federal government back in December that demand was going to exceed supply. And actually I was talking to my comrades or colleagues before this, and this is a good scenario. I'd hate to say that we had supply and no demand, but this is really a good situation, and I feel very comfortable in the weeks to months ahead we're going to have a much higher supply than we've got today. I feel very comfortable about meeting the demand. It's not going to happen overnight, and I caution everybody, this is not going to happen in a month or two. And you know, I talked to Lacey and Tim and Brian about setting a challenge for this region, and I think we ought to challenge ourselves as a region. And I'm going to challenge us to vaccinate 75% of our region. So if Region 5 is approximately 300,000, and I may be off, I know Teresa will fact check that in a minute, but I challenge us to be at 75% or 225,000 by September 1. September 1, is that arbitrary? Not really. That's 7 months away. It's when school starts, it's when college starts, it's when football season starts. And more importantly, it's doable. We can get it done. We don't have the supply to do it today or next week or next month, but I think in the months ahead we'll have supply that we need to challenge ourselves and set those types of goals. The mitigating measures, I don't want to not touch on that. That's still very important. We're all tired of it. We're tired of the distancing, the masking, the hand hygiene. We are emotionally fatigued by it, but it works. And people say, well, how do you know it works? Well, look at influenza. I know influenza is not the virus that COVID is, but we're not having a flu season. They didn't have the flu season in the southern hemisphere, and we're not seeing it in America or in the northern hemisphere. And the reason is because we're taking these mitigating measures. So these mitigating measures help. By themselves, you know, distancing is important, masking is important, hand hygiene. They're all important, and when you layer them, they become quite effective at preventing the spread. So they remain effective, and I encourage us all to continue to do that. I do want to echo the confidence in the healthcare delivery system. I believe that all the hospitals have processes in place to distribute this vaccine timely and efficiently. So I'm going to leave this podium and telling everybody out there that I'm very hopeful, and you should be too. But people say, when is this going to end? And it depends on you. It depends on us literally rolling up our sleeve and getting vaccinated. So the sooner the better, and I'm ready for us to get through this time period in our history, and let's move on to the next challenge. So thank you all for having me today. Thank you, Lacey.
Thank you so much, Dr. Jordan. Great message of hope, because that's certainly what I feel whenever I think about the vaccine. So our next guest speaker is going to be Dr. Heyman from St. Pat's.
Thank you, Lacey, and I would agree with almost everything Max said. I think that from a hospitalization perspective, we are really at a plateau. We did see an increase after Thanksgiving, but it has leveled out. We are hoping that this will trend down, but we are lucky that we're plateaued as opposed to some of the other regions of the state that are seeing a fairly constant increase. In terms of the monoclonal antibody, I would agree, and we have multiple facilities in the region that are offering it. We have seen that it is effective in helping to prevent hospitalizations. We've not done quite the volume that Memorial has, but I can only recall one patient who we gave the antibody to that ended up requiring hospitalization. So it is very, very encouraging. In terms of vaccine, we have administered quite a bit of vaccine and also have not had any real severe reactions. We've just had the kind of expected arm soreness and muscle aches. And we are optimistic that with the vaccine supply continuing to improve, both from Moderna and Pfizer, and then hopefully towards the end of this month and next month, there will also be 2 other vaccines that are likely to be approved. And so as we continue to have those products approved, we will see the supply increase here locally. In terms of the mitigating measures, I agree. I mean, we're unfortunately not going to be able to just vaccinate our way out of this current surge that we're in. You know, Lacey mentioned that we're at a peak in terms of cases, and so it is important to try and follow those recommendations. It is difficult, and trust me, everyone is really fatigued with it. But with a combination of vaccine, monoclonal antibody, and the other things that we've learned, there is light at the end of the tunnel. And I think that's the most important message we can deliver, is that we're not there yet, but the progress that we've made in realistically less than a year since this has appeared in Southwest Louisiana, the progress that we've made towards ending this is nothing short of amazing. So I think the things that I want to get across today are that it's not over, but we can see the end, I hope. So that's all I have, and thank you, Lacey, for all your help.
Thank you so much. We have one additional speaker, who is Mr. Brian Thompson with West Calcasieu Cameron Hospital.
Thank you very much. Echoing what Dr. Heyman and Dr. Jordan have said, we too at West Calcasieu Cameron Hospital have seen a plateau in the number of cases that we have in our facility right now. As of today, we have 16 COVID positive patients in the hospital. Our numbers have been running between 16 and 20, which is a plateau for us. We did see a little spike after Thanksgiving as well. The monoclonal antibodies have helped. We're administering those to outpatients. I've talked to a few of the patients who've received the monoclonal antibodies, and they said, you know, usually within a day or two after receiving them, they're feeling tremendously better. So those are working, and I'm glad that we're able to provide that service to our community. We've administered roughly 501 doses of the vaccine. Right now, it's the supply that's limiting us and what we can do. We have a waiting list with about 202 people on it right now. So in the weeks and months to come, as the allocation increases, we'll be able to administer more. One of the big challenges we face is we have a sub-zero freezer to be able to store it frozen, but currently, because the allocation is so low, it's being shipped to us thawed. And once it's thawed, you have 5 days to administer it. By the time we get it, about 4.5 days, and so logistically, you know, sometimes it's a little challenging, but we are administering everything we receive. We've had no wasted doses, and as far as the side effect profile, much like what they have said, we've only seen very mild side effects, fatigue, malaise, some arm soreness, but nothing really serious, no anaphylactic reactions or anything like that. So everything seems to be going pretty well so far. I'm excited that to start receiving more doses and start vaccinating more people. So that's it. Thank you.
Those are all of our guest speakers for today from our medical community, so I'm open for questions.
Maybe I shouldn't do that. I've heard that some of the hospitals wound up with extra vaccines because not all the employees wanted to receive them, and that there have sort of been these impromptu, you know, reaching out to people in the community saying, if you get here right away, we'll give you a vaccine. Is that still the case, and how does it work?
So that does happen occasionally because the vials are designed with either 5 or 10 doses in the vial. And so once you puncture that vial, you only have a short window of a few hours to utilize that product. We don't want any doses of this vital vaccine wasted. So occasionally, if someone who is supposed to get vaccinated can't, you know, they were on the list, let's say they became ill and they're not able able to get vaccinated, or, they, for some other reason, were not able to come to their appointment, there may be an extra dose once that vial is punctured that needs to be used and needs to be used very rapidly. The other thing is that some of the products, they're supposed to come with 5 doses, but it is occasionally possible to get a 6th or a 7th unexpected dose, we're calling them angel doses, out of the vial. And so when that happens, there's also usually a very short time frame. So anyone who's administering the vaccine in the community has sort of been made aware that, it's better to go in an arm than to be wasted. And so there are sometimes these impromptu opportunities that present themselves.
I mean, can members of the public request to be put on a short notice list, or?
I'm sure some of our facilities are probably keeping a list of last-minute notice. We're trying to encourage facilities that receive vaccine to use it within the current priority category when possible. So a lot of folks already have waiting list of people who fit the category currently, the 70 plus or healthcare workers. But, it's definitely better to give it to somebody outside of the priority category than for it to go to waste as well. So I think, that is already happening.
And what are the side effects that might require someone to seek medical care? I think I know, but just to double check.
So most of the more severe reactions are happening very quickly after the vaccine, even though they're very rare. So anaphylaxis usually starts, someone will start to feel very short of breath, or they'll feel their throat starting to feel like it's closing or something like that. If that happens, that is one of the reasons that we are recommending waiting a period of 15 minutes after vaccination where someone is observed, just in case they should be the rare case that occurs. We are asking that any severe reactions like that get reported to our ID Epi hotline so that we can keep track of, how often that's happening. I'm not aware of any cases in the region here that has happened with yet, but that would be the primary severe. When we talk about having a severe reaction, that's the primary one that we're talking about, is an allergic reaction.
And you mentioned that 56 providers have signed up wanting to receive the vaccine. Does that include the ones who are currently administering it?
Yes, those are all of the sites, the medical providers, clinics, hospitals that have currently signed up to be able to have product shipped to them, to be able to administer to the public whenever product is available.
So would you recommend that people sign up everywhere that the vaccine is being offered, or just, pick 1 or 2, or how would you recommend people deal with that?
I don't think it really is going to, in the long term, benefit our community in terms of planning for people to be signed up on 20 list, right? Because then it causes mass confusion if you don't call and cancel those 19 other appointments whenever you finally get a call. So once again, I'm encouraging patience. It will become more available as the weeks go forward. Before you know it, it'll be, we'll have vaccine available in multiple locations across the community. So try to, stop, take a deep breath, be patient, and we're hoping that, that there's definitely something to be said about people receiving medical care at their normal site of care, where reasonable and feasible. So, most people have relationships with their own pharmacy, with their own doctors who know them the best and who know their medical history the best. So, trying to kind of, stick within your usual sources of medical care and maintain those relationships is always a good touch.
I was asked to ask if you have any estimate as to when those, receiving the vaccine, when they'll move from the current category to include more people.
I think that I don't know that we know the answer to that question yet, because in some way it depends on how many people within the current category want to get vaccinated. And in another way, it also depends on the supply of vaccine and how much it ramps up in the coming weeks. So that's a very difficult question to answer, and I don't think we can really give a solid timeline on that.
Do you want to talk a little bit about the timing of testing? Because I talked to one healthcare professional who, said that it was analogous to getting a pregnancy test the day after you, potentially have,
Right.
the opportunity to get pregnant. So I know that might sound funny, but I mean, you know, I think there are a lot of people running around getting a test the day after they think they may have been exposed and turning up negative, and then
Thinking they're fine, right. So we really recommend for sure waiting at least a few days. Really 5 to 7 days is sort of the earliest time frame at which you would want to be tested after a known exposure to COVID, just because it does take time. And if you test on, you know, the day after you're exposed, more than likely that test is going to be negative because that virus hasn't had time to get in your cells and replicate to where we can actually detect it yet. So it is too early if you're testing the day after you're exposed. Really, the 5 to 7 day window is the earliest you'd want to test, and that's probably the time that I see most folks testing is in that 5 to 7 day window. But really, even if you test on day 7 and you're negative, it is still possible. It's less chance, but it is still possible to then end up testing positive beyond that window. So really, the 14-day period that we've been talking about forever still applies.
so if you go 14 days and you never have any symptoms, at the end of 14 days, there's no point in getting a test. Is that right?
So yeah, after 14 days, you can, you know, remove your quarantine. If you have not had any symptoms, it is fine for you to resume activity.
And for those who have received the vaccine, and I guess, well, they still obviously have the second dose, but how many days until it's fully effective?
I don't think we have a solid timeline on that, but just based on our history of previous vaccines, I would probably say after the second dose. After the first dose, the protection is still relatively minimal. After the second dose, I would probably say you want to wait at least, 1 to 2 weeks before your body has really had time to mount a good immune response. The way the study was designed is it tested for cases of COVID that happened after vaccination. They didn't do serial lab work every day on somebody to see when they mounted an antibody response. So that's one of those pieces that I'm sure we'll eventually have a definite time frame, but that answer of probably waiting 1 to 2 weeks after the second dose before we think you probably have built immunity is just based on history of how other vaccines work.
Well, and people who have had COVID, how long should they wait to get the vaccine, or how long do you think they have immunity?
So until recovered. So we're not recommending that people who are actively sick, you're sick, you're coughing, you got fever, you shouldn't be receiving a vaccine if you're actively sick. But once you meet the definition of recovery and you're feeling better, and I feel like you're pretty close back to your baseline in terms of how you feel, then it's safe. There's not a specific time frame outside of at least waiting until you meet the definition of recovery.
Okay, and wherever you get a vaccine, it should always be free?
Well, the vaccine itself, yes. There should be no cost for the product. Now, many cases can bill for the administration of the vaccine. So, that's for the medical personnel time to actually provide the shot to you. So those charges, they shouldn't be going directly to patients for the most part. I think most of those will be billed and covered through insurance. So there should not be, a large amount of money that is required to get vaccinated.
Well, and at this point, do you need to, call upon retired nurses or other medical personnel to help administer the vaccine, or do you want people to sign up for the point at which perhaps you will?
I do think that we have systems in place already for volunteers. So we have a robust medical reserve corps here in Region 5 that does have names of medical professionals who are often called upon to help with things. We also have the Louisiana Volunteers the LAVA system, which is Louisiana Volunteers in Action. And so that's another mechanism to sign up to volunteer. I think when enough vaccine becomes available, it could be an all hands on deck situation. But we do have to remember that a lot of folks who are retired may be in the high risk category themselves. And so we do have to take some care to make sure that, we have all the proper systems in place to protect them and that we vaccinate the vaccinators first.
there's a portion of the population, especially within the elderly ranks, that may not have access to computers or know how to use them well. What do you suggest they do to get on a list for a vaccine if they're eligible?
You know, right now, I know that a lot of the pharmacies that are administering are only doing online, so if you're trying to book appointment at a pharmacy, trying to get someone else in the family to potentially help that person enroll if they have access to an electronic device. I know that's not a perfect solution for now. I do think some places are taking phone calls, and I do anticipate that at some point, as we have more vaccine available, I know for any large-scale sort of operational sites that could eventually happen, we would definitely plan to have systems for folks to call in, as well as register online, because we definitely realize that that's a huge barrier for a lot of folks.
I have one more question. I don't know if the health department is still, supplying this information regularly, but at one point, they were listing, where the greatest number of outbreaks occurred, like whether it was, a private function, like a funeral or a wedding, or, in a restaurant. And I just wondered if, you could comment on that at all. I mean, like, it's still safe to have food delivered and that sort of thing?
Yeah, so the outbreak data is still available on the website. Nothing has changed about that reporting. We know how COVID spreads. So COVID spreads whenever you're around other people in close proximity. So any setting that you are around people, who are outside of your family group, that increases the risk, and the more people, the more the risk. I don't think that we can point to a specific setting that people are getting it. I think it's any setting that people are around other people who are not in their family is a possible transmission.
So if you're having food delivered and groceries delivered and things like that, you shouldn't worry about it?
Those are typically, Teresa, very brief interactions of transfer of food. And most of those places who are doing deliveries probably are doing contactless delivery now. They leave your food on your step, and then when the person leaves, they text you and you go outside and get it. So really, I don't think that having deliveries to your home would be considered a high-risk activity.
I was thinking more in terms of the people preparing food and that sort of thing. Is food safe?
Is food...
with COVID prepares it? Are the acids...
Oh, you're saying, so if I have COVID and I'm preparing a meal for somebody else to go bring it to them, is that safe?
Yeah.
I probably would say just because food, if you're preparing it, there's probably a lot of high contact touches to those surfaces. I would hope that people who are ill with COVID are not preparing food for other people, if possible. But as long as the food is cooked, I don't think the food is the problem. I think it's all the packaging.
Okay. Thank you.
Okay. That's all I have.
We want to thank Dr. Kavanaugh. It's very helpful. A lot of progress, and we appreciate all the gentlemen coming today from our local hospitals. In listening to all of you, and I think, Dr. Jordan, you said it best. If you'd have told us a few months ago we'd be here, you'd be very pleased, and I think that's great sentiment. It just feels like we need some patience, and it's coming, and continue the protective measures. We want to wrap up our briefing today with comments from a couple of our elected officials. First, we'll ask Police Jury President Brian Abshire to come forward.
Thank you, Mr. Bean. The COVID virus has impacted our area tremendously and over the past year, as it has for the whole country and the world. But throughout this period, we as public officials have worked very closely with state public health organizations, the regional office, and other agencies to help facilitate and combat this pandemic. I know it's not fun, but we're all in it together. This vaccine is developed. It's going to help to prevent the virus from spreading. We just need to be patient so that we can all get our dose. It's important that residents continue to take protection measures, wearing your mask, washing your hands. Like I said, it's not fun. I don't like doing it, but we're doing it for our mothers and our grandmothers. So keep that in mind. You know, when you walk up to the store and you see that sign on the door to mask up, go back to the car and get it. I forget sometimes, but I turn around and go back and get my mask. So all that being said, things are looking up, and I just encourage everyone to stay positive and stay patient. So thank you.
Thank you, Brian. We'll next hear from Nick Hunter, Mayor of Lake Charles.
Thank you, Brian. Good morning, everyone. First of all, I want to let everyone know that I'm doing well. I did contract COVID-19 a couple weeks ago. I thought about not saying anything, but after I had to cancel several engagements, I thought, you know what, let me just go ahead and be very transparent and tell people what's going on. And there's certainly no shame in that. I mean, everyone in this community has been affected by this in some form or fashion. I will also take this opportunity to kind of be a little more specific and actually tell people about that situation and actually what happened. It was Christmas Eve, and I'm 99% sure that I know what happened. We wanted to see some family members that we hadn't seen in a long time. And my wife and I made the decision that we would stay kind of quarantined in the house for a couple days before Christmas Eve. We went out Christmas Eve morning. We got tested. We tested negative. We called the family members and we said, okay, we're good to go. We're negative. We're coming over for Christmas Eve. We're going to enjoy a Christmas Eve with the family. Fast forward to a couple days later, those family members called us and said, well, we were around someone a day before Christmas, and they tested positive. And so we knew that we were exposed. So, of course, we quarantined immediately, and the Tuesday after Christmas Eve, I tested positive for COVID-19. My quarantine ended on Friday of last week. Very luckily and blessed that I only had about 48 hours that were rough for me, and especially compared to what I've heard some other people go through, and certainly even ultimately some deaths that have occurred. My family feels very blessed. But we are fine, and I offer that story to say that I think we are at a stage now where we're certainly still encouraging people to understand that COVID-19 is serious. Dr. Heyman said we cannot vaccinate our way out immediately of what we're going through right now. And that is true. I have been a proponent of wearing masks, and I will continue to encourage people to do that. And it's not because I turn on the news and see someone 3,000 miles away that tells me to put on a mask. It's because I have spoken with hundreds of local, trusted medical personnel, local trusted doctors, local trusted leaders in the medical and scientific community who have told me that these things are not 100%. Nothing is 100%, but these things work. In general, they work. And so we are encouraging people to still continue to use those mitigation efforts. Last week, I was going through my cell phone trying to find a number, and I found myself literally passing up, as I was scanning my phone, passing up 2 names that had died in the last 2 months from COVID-19. People that I knew, friends, well enough that their cell phones were in my phone, and if I texted them, they would have texted me back immediately. And it really was a wake-up call. And I can tell you that if I just take a moment, I can count 8 people that I know that I consider friends that have died just within the last 2 months from COVID-19. So just as we encourage people to understand it's serious, I also believe we have to find a balance. And that's a difficult thing to say, because I'm not going to be one that tells people you have to stay in your home and you can't leave your home forever. And until this thing is completely eradicated, you can't leave your home. I can't do that, and I don't think anyone in this room is saying that. What we're saying is be smart about it. Use caution and find a balance, and especially when you are around others that you know are susceptible. Use caution. Be careful. The early stages of this event that we have gone through were a lot scarier and more precarious, I think, than where we are today. I did not know Dr. Kavanaugh that well 9 months ago. And I remember some of those first meetings with Dr. Kavanaugh. Those were some scary moments for locals because the unknown was there. We had never talked about a pandemic. I mean, I've been on the police jury before. I've been through some hurricanes. I've been through some other events, but a pandemic was never something that had crossed my mind that I thought as mayor we would be dealing with. And those early days were filled with a lot of unknowns and a lot of uncertainties. And I want to echo some of the other comments that were said today. If you had told me after some of those meetings, hey, in January of next year, we're going to be talking about the idea of a vaccine, we're going to be where we are today, I don't know if I would have believed it. But we did believe in the power of science and the power of medical advancement. And if you look where we are today as America and this nation, the advances that we have made are just amazing. So just as we remind people it's serious, just as we remind people that we're not going to be finished with this tomorrow, we ask you to find that balance, take this seriously, but also understand that, hey, we're in the fourth quarter. We are in the fourth quarter of this. There is light at the end of the tunnel. Dr. Jordan, I accept your challenge. And as soon as the vaccine is made available to me, I will get the vaccine. And again, I am making that decision not because I turned on a news service and saw something that was broadcast to me from 3,000 miles away, or got online or on social media or asked my brother-in-law what they thought about the vaccine. I'm making that decision because I've talked to people like Dr. Heyman and Dr. Jordan who I would trust with my life, and they have given me their advice and their counsel. When I did contract COVID-19, I'll tell you, my physician was out of town, and so the next call I made was to Dr. Heyman, and it was only Dr. Heyman and not Dr. Jordan because Dr. Heyman was a student of my mother-in-law, and when your mother-in-law tells you to do something, you listen to her. And she said, you call Dr. Heyman, and you do what he says to do, and I did that. And so that's what I'm encouraging people to do right now. You don't have to listen to me. You don't have to take my personal advice. Elected officials are probably some of the last people that the general public want to hear from right now with everything that's going on. But listen to your doctors. Listen to your doctors. And if your local, trusted medical professionals are giving you advice on something, take it. Take it. If COVID-19 had never occurred and we went to our doctor because we were sick, we would take their advice. The vast majority of us would take their advice. So yes, I will be receiving the vaccine as soon as it's available. I encourage others to do the same. I will end with a couple other comments. I understand that our blood supply is very low right now, and I encourage people to donate blood if possible, and that is something that we've been discussing with LifeShare, that we are at a very critical level right now. Please consider donating blood. And the last thing I'll say is this event that we have gone through, which we are not finished with yet, has been quite a challenge. It has been a new experience for a lot of people, certainly in this room, and a lot of local elected officials. I don't know what the history books will say about the entirety of our response to this event in Southwest Louisiana. But I can tell you this. I say this with a lot of confidence and knowing that I feel very strongly about this. Locally, when we have gathered to make decisions, we have made those decisions with the counsel and the advice of experts and professionals and local medical experts. So there may be some decisions once this is all rehashed and the history is told that we might go back and say, I wish we wouldn't have done that, or wish we would have done something different. But I guarantee at the time when we made those decisions, and continuing today, we are making decisions with the most up-to-date information that we have, and we are getting that information from trusted, reliable, local medical sources. And I'm proud of that. And I'm proud of the teamwork that has occurred here in Southwest Louisiana. It has been a road with some stumbling blocks and some obstacles, but I believe we are where we are today because of a lot of teamwork that has occurred in Southwest Louisiana between locals, states, and our federal counterparts, and also the local medical community. Very proud of our local medical community. Thank you. And that's the end of my comments, unless there are any questions.
I was just wondering if anyone knows whether there's a problem with employers allowing people people to stay home and quarantine. I suspect that there are probably some people who are afraid if they say, well, I gotta stay home for 14 days, they probably won't get paid, or perhaps they'll get fired. Any thoughts on that, and anything you would say to employers who, basically won't let their people get off?
Well, look, I would encourage everyone to research the Family Medical Leave Act. Certainly that has some protections for employees. I can tell you at the City of Lake Charles, if one of our employees is sick, we're not having them come to work even if it's not COVID-19 related. So we have been able to maneuver around that. Certainly there were times in recent months where it was more difficult than it is today. But I would encourage individual employees to research their options. There are protections for that. I know that in general, not only because of COVID-19, but because of hurricanes, the labor pool in Lake Charles is a lot tighter than ever before in our recent history. Thank you, Teresa.
All right, thank you, Mayor. That concludes our briefing for today. Because this is a evolving situation, we don't have a scheduled public briefing. However, we will depend on Dr. Kavanaugh to keep us informed, and when she feels in concert with the other local medical professionals that it's good to get another word out, we will schedule one. I suspect as the vaccine supplies are further along, that's when we'll reschedule, and certainly we want to keep the public informed. So at this time, we will conclude this, and we appreciate the attention of everybody in the public. Have a good day.